Hi, my name is Kirk Hamilton. I'm a practicing physician assistant of 30 years, nutrition, prevention, integrative medicine, author, health educator, and host of this show, the Staying Healthy Today Show. Today's show topic is interstitial cystitis, things that really help. Sometimes interstitial cystitis is called IC. Maybe 4 million Americans have this condition of bladder pain and sometimes stomach pain, pain with urination. Mostly they're female, more middle-aged. And it's a very disconcerting condition. And over the years, I've had some good results helping people with reduction of symptoms. Not curing, but getting significant reduction in symptoms. And I had 2 patients come in this week that reminded me, one who's been controlled with the therapies that we do here, and another one who has a perfect history for a setup for interstitial cystitis, and I think she'll do well if we can go down the road that I want to go. So, history. I take a history of patients by going through their decades in life, 0 to 10, 10 to 20, etc. What I'm looking for in an interstitial cystitis patient is someone who's been on rounds of antibiotics, for example, a young child, chronic earache, sore throats, tonsillitis, multiple antibiotics per year. A teenager who has acne, let's say, been on antibiotics several years for that. A middle-aged or young person who's had lots of bladder infections or maybe yeast type infections or stomach infections. So I'm looking for that history. I'm also looking for a history of hormones, maybe birth control pills, because that can cause a reduction in free testosterone, which can aggravate the tissue down there in the bladder and the vaginal area. I'm also looking for perimenopausal women. They'll be low in estrogen, testosterone, and DHEA, which all can affect that area. So here are some testings that I do on patients, and it's not limited to this, but this is a focus. Number one is I do different types of stool exams on patients, looking for yeast, parasites, bacterial overgrowth, and digestive dysfunction. I do salivary hormone testing. I can see hormone ratios, but also I'm specifically looking for low testosterone, DHEA, and estrogen. I may do food allergy screening with IgG, RAS testing, but I like the basic elimination diet better, but sometimes I do that. So here are things that help. Number one is eliminating foods. Almost every IC patient or interstitial cystitis patient will tell you that certain foods aggravate their bladder. So it's not the cause, but it can aggravate their condition. So I have people eat off my basic elimination diet. There'll be a link to it in this YouTube in the description, and it's basically eliminating 10 or so of the most common allergens. But other foods that we're looking for, that I'm specifically looking for, are chronic sugar cravings, bread product cravings or wheat cravings, dairy, cheese especially cravings, coffee, chocolate, tea, those things, especially coffee, can sometimes aggravate it. Citrus cravings sometimes can do it. So we look for particular cravings. We have people eat off this list, and obviously eliminate any food that aggravates you. We treat the gut. So if there's overgrowth of yeast or parasites or bacteria, I treat them accordingly. Sometimes with antifungals, in fact, frequently, especially if there's a history, even if it doesn't show up in the stool, and then sometimes with antibiotics for bacterial overgrowth, and then always probiotics and some herbs like berberine or caprylic acid or a tannic acid product for the treatment of yeast and other bacteria. Supplements, not a lot. Always a probiotic. I use Culturelle frequently just because it's simple. I can tell anybody anywhere in the country to get it, and you get the same quality product. Vitamin D is in David, 2,000 to 5,000 IU a day. And then sometimes I'll give additional vitamin A, maybe 2,500, 5,000, or zinc, 20 to 40 milligrams, but I usually test for those. So those are the simple things that you can do that can really, really help with interstitial cystitis. But pay attention to food, pay attention to treating the gut. And those hormones being replaced, especially testosterone in particular, and estriol for the vaginal cream mixed with testosterone can be very helpful in that regard. You can call me in the morning. We have an open phone line at Health Associates where I work, 8 to 9 in the morning Pacific Standard Time, 916-489-4400. That will be in the description below the video. Sign up for my health letter, Kirk's Power Aging Tips, and you'll get updated on when I do discussions like these and videos and talks. Share the information. These are good, solid things that you can learn from. So my name is Kirk Hamilton. This is the Staying Healthy Today Show, and I will talk to you soon.